Good morning, doctors. Let us try to understand something about ischemia. Now, what is ischemia? You can see over here, ischemia is imbalance between demand of blood and supply of blood to the myocardium. हृदयाला जेवढं रक्त गरजेचं आहे तेवढं रक्त न मिळणं म्हणजे ischemia. So remember, in cardiology or in health sciences, the most important thing is whether demand is fulfilled or not. If it is not, then there is a problem. These are relative terms. Supply is a relative term. It has to be coordinated, or it should be equal to the demand. If it is not there, then there is a problem. So ischemia is the same. It is imbalance between demand and supply. Now, which are the factors which can affect the demand or which will increase the demand? So there are two probabilities. If demand is increased, then there will be ischemia, or if supply is reduced, then there is ischemia, or both. That means demand is also increased and supply is also reduced, then there is ischemia. So which are the conditions when the demand is going to increase? First condition is heart rate. If heart rate is going to increase, then there will be an increased demand of blood. So wherever you will be conducting stress test, there will be an increased amount of demand of blood or oxygen to the myocardium. So that is a heart rate. Second thing is contractility, that means force of contraction. Whenever there is an increased force of contraction, there is a more amount of blood required to the myocardium. Now, as you know, whenever the sympathetic system gets activated, it stimulates the beta 1 receptors on the heart. So adrenaline is going to stimulate the beta 1 receptors, which is going to increase heart rate, that is a positive chronotropic effect, and the contractility, that is a positive inotropic effect. So heart rate is increased, demand will increase. Contractility is increased, demand will increase. Then third point is wall tension. Now this wall tension is contributed by systolic blood pressure and the volume of the blood in the left ventricle. So if the load on the heart is going to increase, then there will be a more amount of wall tensions which will increase the demand of blood by myocardium. So please do remember, whenever there is an increased volume inside of the blood or the vasculature, or the increased amount of blood during the in left ventricle, then it is going to increase the demand of blood to the by the myocardium. So volume increase will impact on demand, it will increase the demand. Increased systolic pressure is going to contribute to increase in the wall tension, so that will again contribute to the increased demand of blood. So these are the factors which affects actually which increases the demand of blood by myocardium. Then one more thing, that is a left ventricular hypertrophy. If you have a hypertrophic left ventricle, say for example the patient is having chronic hypertension, or he is a patient of ischemic hypertension in which he has developed left ventricular hypertrophy, in that stage there is increased demand. Please do remember, there is no effect on supply, but still as the demand is increased, then you can see the ST changes on his V5, V6 leads. So these are the left ventricular hypertrophy. If there, then it will impact the you can say demand will increase. Now the factors which affects the supply of blood to the myocardium. The first factor would be endothelial dysfunction. That means if you have endothelial dysfunction, then there will be a great impact of it on coronary blood flow. If you have endothelial dysfunction, there will be a great impact on coronary blood flow. If you improve the endothelial dysfunction, coronary blood flow will definitely improve. Please do remember, atherosclerosis is the sclerosis. The main problem with the atherosclerosis is sclerosis. That means stiffening of hardening of the vessels. Now this hardening can be reversed with improving endothelial function. If you can improve the endothelial function, the vessel will be able to dilate as a response to exercise or increase workload. That is important key out of it. Another factor is collaterals. So if you have a good collaterals, then there are high chances that the blood supply to myocardium will increase. If you have a good aortic diastolic pressure, now please do remember that whenever the left ventricle is going to contract, the blood from the left ventricle is going to come out and going to deliver to whole body. In a diastole, the blood column in aorta, consider this is aorta, these are the aortic valves, okay, and these are the aortic valves. So what happens whenever blood comes out? So blood is aortic valve would be in this manner. So blood is coming out from left ventricle to the aorta, and during diastole the valves is going to get closed. So whenever valve is closing, that blood which is there on the top of the aortic valve, or in a diastole the blood which is there in the aorta, is going to perfuse your coronary arteries, because coronary arteries are above the aortic valve. So what is going to happen if you have a good aortic diastolic pressure, then there will be impact on the coronary arteries. So you can understand simply that if the patient is having aortic regurgitation, that means if the aortic valve is not able to close properly during a diastole, then it will remain open and the blood will go down to the left ventricle. Instead of going to the coronaries, it will go to the left ventricle cavity. That means that chamber, it is not expected, so it will affect the coronary blood flow. So that is the aortic diastolic pressure, which gets affected during aortic regurgitation. Another cause, the major concern of ischemia is thrombosis, that is blood clot. If you have a blood clot in your coronaries, you're going to get ischemia. As we know, the blood clot in coronary is going to induce heart attack. The cause of heart attack is not the atheromatous plaque, it's the blood clot in the coronary circulation. So that is a thromboembolism. Then another factor is a diastolic time. If your diastolic time is increasing, that means if your heart rate is increasing, look, in a 1 minute if someone's heart is beating for 60 beats per minute, एखाद्याचा हार्ट रेट 60 आहे आणि तो हार्ट रेट 60 चा जर तो 110 झाला, तर 110 होत असताना त्या डायस्टोलचा टाइम कमी होत असतो, आणि if the diastolic time is reducing down, then it is going to affect the coronary blood flow. So IHD चे पेशंट मॅनेज करताना heart rate is the most important point to be considered. Then there is a spasm or autoregulation. That means if the patient is having, look, what is autoregulation? If the viscosity of blood is going to increase, coronaries are going to offer a resistance. Coronaries ला resistance offer करण्याची एक सवय असते, tendency असते. जर blood मध्ये viscosity वाढली तर resistance coronaries वाढेल, blood supply पुढचा कमी होईल. That is the first thing. Second thing, जर blood मध्ये oxygen वाढला तर reversal spasm मध्ये जाते. These are the auto-regulatory mechanisms. So please do remember that auto-regulation means if the viscosity of blood is increasing, blood supply to the myocardium is going to reduce. This is all the picture of ischemic heart disease. Now, where we can work in IRP मध्ये आपण कसं काम करणार आहोत ते तुम्हाला IRP च्या व्हिडिओज मध्ये कळेल. Best of luck.